Hey, it's Chris Lyle, the Executive Director of the Touring Career Workshop. We're coming at you today with another one of our special episodes of the HR for Touring Professionals with some relevant information for our industry. We try to cover different topics from physical wellness to mental wellness to financial wellness. And today we're excited to have joining us Mark Fortney, who is a practitioner in Chinese medicine. Mark, welcome.
Thank you for having me.
Yeah, we're excited about this. Chinese medicine is something I've heard about, but I don't know a lot about. So, first of all, I'd love to hear about you and where you're located and a little bit about what you do.
All right. So I practice out of Nashville, Tennessee. My office is in the Germantown neighborhood, and I've been here about in Tennessee about 6 years, and I've been practicing Chinese medicine for almost 17 years. I had
Oh,
been
wow.
previously lived in Asheville, North Carolina, prior
Oh,
to
well,
that.
what a beautiful town. Great town. Yeah.
Indeed. Thank you.
Yeah. So, like I said, I've heard of Chinese medicine, and I know some of the disciplines. Like I know a little bit about what acupuncture is, but tell us a little bit more about it and what you do.
Okay, so I consider myself a practitioner of Chinese medicine, and that is a way to look at how are people in or out of balance. And that can include different physical things that are going on with someone, from chronic back pain to mental and emotional things of stressors in general, and then how those stressors connect to physical things. And so, what Chinese medicine is, it's a way to look at and understand the body and how it interacts in the environment. As part of Chinese medicine, there's different modalities. So, acupuncture is one of the things that most people have heard about, putting needles and placing needles in specific places to help treat those things. And then there's also things on diet. Tui Na, which is like a massage kind of physical manipulation to help stuff. There's things like cupping, many people have heard of, where we use cups that pull the skin and help release fascial tissue. There's things called gua sha, which is a type of using a tool to scrape the skin to bring up a flush of blood to an area so that that can help release a lot of muscle issues and tension there. Then there's also thinking about uh, exercise, movement, diet. So there's different herbs can are another component of that. So when someone comes to see me, what I do is listen to what's going on and try to take that in. So if someone is experiencing physical pain, I want to know, how did that start? Where did that happen? And then try to figure out what's the best modality to use to address that. It could involve different things depending on what's happening for someone.
Very interesting because see, right, just in these just a couple of minutes talking to you, I didn't realize how much was involved, all these different modalities. I just thought it was kind of acupuncture. I didn't realize there was all these
Mm,
other options. And so really it's a form of medicine. It's learning, you're listening to
yeah.
what somebody's talking about, what's going on physically, emotionally, whatever, and then deciding what the best course of action is for them. So it's not always
Hmm.
just acupuncture.
Yeah, it's not always just acupuncture, and it's a way to look at the whole picture. Usually I find that someone doesn't just have a sore back. They don't just have stress in their work, but they don't have one thing. But as far as Chinese medicine goes, we're interested in seeing, how does everything fit together? What are the different systems of the body doing? How do they interact? How can we kind of gently push someone, give them a nudge toward better balance in all those ways? So that's kind of the underlying principle is, most people have heard about qi. That's something you hear about, which is kind of energy in Chinese medicine. And part of the idea of the energy is we want to have a smooth flow of qi through the whole body. So that can be
Sure.
blood, that can be muscle, that can be our emotions too. If we're tense, tight, in a fight, flight, or frozen mode, things aren't moving and flowing through us. So different people will require different things to help those get moving.
Okay, that makes total sense. So let's just
Yeah.
take one of your disciplines, and I understand there's several disciplines you do and several things you do, but I'd love to learn more personally about acupuncture. Like that's something I've heard
Okay.
about, but talk to me about what the acupuncture procedure, what a person might expect coming in to see you for that.
Great. Yes. So when someone comes in for an acupuncture visit, usually they have a reason, something they want to address. So the first thing we do is sit down and talk. And I hear about what's the history of that? How did that start for you? What's been going on? I want to learn and understand as much as I can about that. I also want to get a picture of how's your overall health. Maybe you came in for back pain, but I want to understand how's your digestion, how's your sleep, how's your, what do you do for exercise, different things like that. Then I'll think about those things. I'll have you hop up on the table. I have a massage table in my office, and the person will lay down and relax, and I'll feel your pulse. So when we feel the pulse in Chinese medicine, it's sort of like feeling the pulse in Western medicine. I'm feeling beats of your heart on your wrist. And when I feel that, there are different positions, and they correspond to the different systems of someone's body. In Chinese medicine, we have 12 main systems, and we label them. They're called names like the Western organs. So the heart, the kidneys, the lungs, the liver. So those systems do relate and connect to those physical organs, but they're also
Mhm.
sort of a system through the body, and there's a channel or meridian that they are correlated with in Chinese medicine. So let's say you came into me with back pain. I'll
Mhm.
think about, oh, where's your pain and what meridian is running through there. Then I also want to see other aspects of what's going on with that in your body in other ways with that system of, let's say, the kidneys, the bladder, the gallbladder, the liver. I'll look at those and see, oh, where do I feel that there's congestion? And sort of on what level is that congestion in terms of, like, is it down at the deep part of your structural alignment of your skeleton? Is it in the muscle? Is it in the tissue? How do we want to start moving that? And then also with that, we're thinking of, oh, how's that related to how you handle stress, how you hold that in your body, in your nervous system? With working very long hours, having all different kinds of, you have both mental and physical taxation of that. So
Sure.
it's going to manifest a little bit differently in different people. And so that's another thing I'll say about how I practice is to tailor what I'm doing to the person. So it's very uh, individual for what I'm looking at and how I'm going to address a problem.
Very okay. That makes total sense because yeah, I mean everybody's physically different and everybody's going through different things physically and emotionally. So I that makes sense to me that you would treat each of those in different manners. That's very interesting. How long like does an acupuncture session last? Like I've never had that done.
Yeah. So the first time I see someone, I usually spend about an hour and a half with them. During that time, so I'm going to get them, we're going to talk for a little while. I'll get them up on the table. I'll feel their pulse. I'll look at their tongue. That's another diagnostic tool for us. And then I may choose to do some kind of adjunct treatment, like cupping, gua sha, tuina, depending on what addressing. So
Mhm.
then I'll usually insert some needles in that person. The needles are very thin, they're single use, they're disposable, so I throw them away after in a sharps container, and I only use them once. And so I'll place the needles, that really depends on what's going on. But I think about the pulse, the meridians, what's happening for that person. And part of the idea of the needles is they're grabbing the fascial tissue. So they're sending a signal on a very physical way to your body. But you may feel the needle, but it hopefully won't be very painful. If it is, that's I want to readjust where I've put that. So then usually I'll let the person rest with the needles for about 20 minutes to half an hour. I may use a heat lamp on them depending on what's going on, if there's an area of soreness or on their feet, just to help them relax. And during that time, some people like to have the little cover over their eyes. And so you have a little period of rest for your body to integrate with the message the needles are sending. So a lot of the idea of the acupuncture is, I'm not doing a surgery on someone. I'm
Right.
signaling to their system to wake up and heal itself in some ways. And so then I'll let people rest. I'll come back to the room. I'll remove the needles, and then I'll check their pulse again. And at that time, I'll be able to see, oh, how did things shift or relax, and look for that, and then get them up off the table. Occasionally, at the first time or so that someone has acupuncture, they may feel a little lightheaded, dizzy, but many people don't.
Hmm.
Um, and then we'll get them up, get them checked out, and then usually you'll feel kind of the responses in your body answering that call of the acupuncture over the next 24, 48 hours to
Oh, wow.
see, how does your body kind of start to heal itself from that call.
Very interesting. Okay.
Yeah.
So, and again, the message I'm hearing is very similar to traditional medicine. Is every patient's different. That you're not going to
Yeah.
treat me the same way you might treat the next person because we're all going through different things, and that's it comes to as even as specific as where a certain needle would go in somebody's body should
Mm-hmm.
you determine
Yeah.
that course of action. Okay.
Yeah, and
See, I'm
even
learning
each
stuff.
time you come in, I'm feeling your pulse and checking and kind of adjusting. Oh, let's try this. Let's give a little bit of a different message. Or, part of Chinese medicine is also kind of helping align ourselves with the seasons
Mhm.
and to be in harmony with the environment. Now, people are going to have their individual seasons of, like, maybe you're super busy at work during a certain period. Maybe you're more relaxed and able to rest, and then also the seasons of the year, so
Sure.
how to help people adjust through change.
Gotcha. Okay. Before we started filming, I was talking to you a little bit about our industry, and you know, we've obviously had a very rough year. We've been out of work, but
Mm.
when we're working, our industry it's a tough industry. It's very tough physically. We put our bodies through a lot, and again, it's stressful. It's being away from home and the long hours take a toll on us mentally. So, do you feel like for specifically for our touring industry that somebody like you and what you practice could be a good resource for folks that we work with?
Yes, I do think that I feel as if acupuncture is a way to help bring you into balance. And so, how to come out of that mode of rushing, busy, stress, and also to help deal with physical taxation on your body from those, the physical challenges as well. A lot of people will have, various different physical things from position and holding it, repetitive movement injuries. So, um, all of those things are doable to help treat.
Very cool. Okay. Well, man, I got to tell you, I've learned a lot today. Again, these are terms and some things I was vaguely familiar with, but just in this time, I've been educated as to really what's involved, and it's very fascinating. Is there anything else you'd like to share to our industry about your practice and what you do, and especially share how people might be able to find you?
Um, so how people might be able to find me, I have a website. My website is Pulse, like feeling the pulse, ChineseMedicine.com. And that will give you all my information, my phone number, location. And it explains a lot about the practice of Chinese medicine. People can schedule on there. And that's the great way to contact me and find me for all the anything like that. Um, yeah, I do feel like I could be a good resource and help people. So I'm happy to talk to anyone and answer any questions people might have if they have specific questions about how it will help them for a specific issue. Then that's great. We can talk on the phone and see what might be, if it would be a good fit.
That's great. That's great. Well, again, we really appreciate you joining us today, and we always appreciate the opportunity to educate our industry about options for wellness. And you've definitely helped with that today. And we do appreciate your time. And I'm going to check out this some more. You may be hearing from me. I may come in and see you for a visit.
Sounds good. I'd love it. All right.
Absolutely.
Thank you.
Well, thank you again, Mark, for joining us. And well, that wraps up today's episode. Stay tuned for more episodes and make sure you subscribe below. And we will be back soon with more great content.